All right, good afternoon, everybody. First of all, I want to thank everybody for coming out here. Good afternoon, and this hearing is now called to order. This is the public hearing of the City Council Committee on Children and Youth. The purpose of this public hearing is to hear testimony on resolution number 180828. I want to thank the sponsor of this resolution, Councilmember Blondell Reynolds Brown. I would like to recognize Councilmember Reynolds Brown, who is here today, and that we will be joined shortly by other council members of the committee. I would like to now turn the hearing over to Councilmember Reynolds Brown for opening remarks.
And I thank you very, very much, Madam Chairwoman, for all of those who work with us up to this point. A huge thank you for the numerous meetings we had with Sean Rowley and a host of others that have brought us to this moment. I want to thank the committee chair for scheduling this hearing today on an issue that impacts one of two most vulnerable populations we serve, in this case, our Philadelphia's children. We know that, we've heard the bad news repeatedly, we know that Philadelphia is the largest poor city in the country, with 26% of our residents living below the poverty line. That is 1 in 4 citizens. Poverty has an even greater impact on our children. In the city of Philadelphia in 2018, 37% of children came from homes where poverty is a fact of everyday life. As elected leaders, I believe it is our duty and responsibility, in many ways a moral obligation, to make sure we do everything within our reach to ensure that we tackle the issue of poverty, as it is one of a number of barriers that prevent young people from achieving their potential. The needs of those 37% is the focus of today's hearing. My staff and I started to zero in on this issue of child hunger just under 2 years ago after reading research from Dr. Mariana Chilton from Drexel University, who's with us today. Thank you for your work and for providing the context of what we do. Based on that research, the rate of child hunger in North Philadelphia has tripled in the last 10 years among those who work at least 20 hours a week. In the spring of 2018, my staff and I held a briefing for council members and staff on summer meals programs for children so that we could get the word out to constituents about the resources available. Kathy Fisher from the Coalition Against Hunger was gracious enough to lead us through a very comprehensive presentation along with other experts and colleagues in the field. We learned during that briefing that our city has experienced a steady decline in the usage of summer meals programs. Let's hear that again. We learned during that briefing that Philadelphia has actually experienced a decline in the usage of summer meals program for children. Alarmed, my office and I then sent a letter to every church and place of worship in our directory asking them to be sure to sign up to provide summer meals. So in other words, while access was there, the awareness of that access was lacking. Later last year, we learned that the Trump administration threatened to implement new policies that would make it even more difficult to access federally funded food stamps. When we looked into whether participation in WIC programs has been on the decline since the Trump election, we found the answer to be a resounding yes, that caseloads for food stamps in the city of Philadelphia are indeed on the decline. We have Dr. Linda Kilby from North Inc., who will testify to that and help us understand why. So when we add it all up, we have a city that has high poverty rates for its residents, and particularly for children. At the same time, food insecurity for working families is up, and participation in summer meals and food stamps programs are down. Unacceptable. We need to make sure that our food security safety net is indeed secure, which will require council, the administration, the school district, the nonprofit sector, foundations, media, clergy, both non-traditional sources and resources, and concerned citizens to work collectively to change this paradigm. And so with today's hearing, ultimately, we are looking for solutions, because we can boast about the problem, talk about the problem ad nauseum. All the research is there. If you have solutions and recommendations for how we as a city can do better, that's what we need to hear. Post this hearing, we will do an inventory of those recommendations and then share that with the administration and the school district and other stakeholders to see if we can create a web and glue all of that together so that we can be at a better place when it comes to children who have to worry about eating a hot meal. Thank you very, very much. Madam Chair?
Thank you so much, Councilmember Reynolds Brown, and thank you so much for your leadership on council over the years in supporting issues about our youth, especially in establishing the Fund for Children. I wanted to say personally that when I first came on to City Council, I couldn't have been prouder or more excited to serve alongside of you, continue a long legacy that you have done, and to keep doing more. Thank you. Yes, thank you. So poverty is a moral stain on our society and this nation, and there isn't a more cruel exhibitor of that than the hunger that people in our city and across the country face. And if we are truly committed to the needs of young people and to a moral society in 2019 and beyond, we have to have people's basic needs met. We know that children do better when they are fed. We know that people should not go hungry in the wealthiest nation in the world. I will say that as we open up this hearing, that Philadelphia has tried to be a leader in student access to food for over a century. It was our city in 1894, after all, that started the first penny lunches. I proudly worked with a number of advocates in this room to ensure that there is a universal school breakfast program in every single elementary school in the city, but there's so much more that we have to do, and that's really what this hearing is about. I'm looking forward to hearing from all of our advocates to continue to plan how we are going to ensure comprehensive food access to young people all across the city and to our Philadelphians who need us to do the most that we can do in this time. So with that, the clerk will now read the title of the resolution.
Resolution 180828, authorizing the Committee on Children and Youth to hold public hearings examining the prevalence of child hunger in Philadelphia and evaluating the efficacy of existing programs addressing child hunger.
Thank you. And will the clerk please call the first witness to testify on the bill?
Amanda Wagner, Terry Kerouic, and Wayne Grisella.
Good afternoon, and thank you for being here today. If you could just state your name for the record and proceed with your testimony.
Great. Good afternoon, Chairperson Kim and the members of the Children and Youth Committee. Thank you to City Council and specifically to Councilperson Reynolds Brown for proposing a public hearing on such a critical topic as childhood hunger. My name is Amanda Wagner, and I am the Nutrition and Physical Activity Program Manager in the Health Department's Division of Chronic Disease Prevention. We, the Health Department, are here before you today because we recognize the many ways that food insecurity, poverty, and health intersect. Everyone has the right to enough healthy and nourishing food that helps bodies, minds, and communities grow and thrive. When that right is denied, often because of poverty and inequity, we are contributing to the premature death and disease that affects too many Philadelphians. Our healthcare partners see this connection as well and have shared many patient stories with us of the consequences. One story in particular sticks in my mind. A young mother with 2 children, ages 11 and 15, was told by her doctor during their checkup that she needs to give her children more fruits and vegetables, especially since her 15-year-old daughter is already developing prediabetes. She replied, "I have $2 for dinner tonight, so my choices are mac and cheese or the kids and I go hungry tonight." The choice between less healthy food and nothing is one faced by 1 in 4 of our neighbors and residents every day. And daily choices add up, leading the city's children to be at high risk for such health issues as obesity, future diabetes, hypertension, and heart disease. The CDC estimates that more than 1 in 2 children of color will develop diabetes in their lifetime if current trends continue. And high rates of child hunger in Philadelphia make it likely that rates here could be even higher. We also know that adults will forego food for themselves to take care of the children in their household, affecting their own physical, mental, and emotional health. The city plays a key role in strengthening the safety net against child hunger in many ways. Most directly in the meals the city offers, such as summer meals and out-of-school time, in food programs run at community schools, and in identifying ways that we can address under-enrollment in federal food assistance programs like SNAP and WIC. The Mayor's Food Policy Council, Advisory Council, which is staffed by the Office of Sustainability and I co-chair, also provides a space for anti-hunger advocates and community members to identify further opportunities to fight hunger. I personally have been participating in some of these efforts, including the Summer Meals Coalition, which is a network of summer meal providers who are taking a coordinated effort to map where there are those gaps in summer meals and how we can increase the number of children who are served meals in the summer. And there's a newly formed WIC coalition that's working statewide to advocate for changes to increase enrollment and improve transparency in policies and procedures. My office in the health department has also been working with child care providers in PHL pre-K and in other systems to help them enroll in a program called the Child and Adult Care Food Program that has nutritional guidelines and reimburses for the meals that are served. So though there is progress happening, there is always more that needs to be done or could be done differently. We would be happy to explore additional ways that we can fill the gaps in current child hunger programs and address the food needs of the whole household in a way that increases dignity and social connection. We are also continuing to identify upstream solutions for food program providers, like could they buy food together or think about delivery logistics that can increase their impact. Lastly, while strengthening the hunger safety net is important, it is just as important to build ladders out of poverty that make real changes for the long term. Policies and programs that ensure living wages, job opportunities, and education are also critical in fighting against hunger. It's not enough for children to be fed today, though that is essential. Their families and communities also need access to long-term opportunities. Going back to the story I shared earlier, we should have programs that make fruits and vegetables available to the family, but we also need to make sure that the adult has more than $2 available for dinner. Some of these changes, like living wages, can only happen with city pressure at the state and federal level. In the meantime, we can and are trying to make changes. Lastly, hunger, health, and poverty intersect with social justice and racial justice. There is a need to explicitly acknowledge the ways that historical structural oppression connects with current-day health and opportunity. The city has started this assessment with its racial equity here efforts and its shared prosperity plan, but we look forward to additional ideas for ways that we can integrate this into our anti-hunger work, to work both upstream and down. Thanks for the opportunity to testify. I'd be happy to respond to questions.
Thank you, Mr. Grosella.
You want to go? Yeah. Good afternoon, Councilwoman and Vice Chair Reynolds Brown, Councilwoman Gimp, Chair, and members of the Committee of Children and Youth. I am Wayne Grosella, Senior Vice President of the Division of Food Services for the School District of Philadelphia. Thank you for the opportunity to testify before you today about the school district's initiative to provide healthy meals to Philadelphia students and opportunities for increased utilization of our existing school meal services. The district offers breakfast, lunch, and dinner meals daily without charge to all students in all schools and select charter schools regardless of family income during the school year. We also provide breakfast and lunch to students enrolled in school programming during the summer. Free breakfast for all students was implemented during the 2011-12 school year, and free lunch was expanded from 75% of the schools to all schools across the district during the 2014-15 school year with our participation in the Community Eligibility Program through the United States Department of Agriculture. Free dinner meals are provided at select schools with after-school program. We currently provide annually over 25 million breakfast, lunch, and dinner meals at no charge to 136,600 kindergarten through 12th grade students in 254 district alternative ed, charter, and private school locations served by our 890 in-house unionized staff. We receive no district or City of Philadelphia funding. Instead, we operate as an independent enterprise fund whose only source of revenue is various state and federal student meal reimbursements. On a daily basis, we serve on average 54,500 breakfast meals, which is approximately 43% of attendance, 86,000 lunch meals, which is approximately 68% of our attendance, and 5,000 after-school dinner meals. During the summer of 2018, we served on average 5,000 breakfast and 6,700 lunch meals to students enrolled in summer programs at approximately 110 participating school locations. The Division of Food Service has been focused on increasing breakfast participation over the past few years. It is well established in the literature and the practice that eating a nutritious breakfast positively impacts cognition, while skipping breakfast hinders it. Eating school breakfast is associated with higher attendance, punctuality, and academic performance. At the school district, school breakfast is part of a broader effort to address student health and wellness. We are strengthening collaboration across departments to address issues identified in the School Health Index reports, particularly around the need to strengthen the implementation of certain aspects of the district's wellness policy. The Central Level Wellness Committee is currently being reorganized to support the whole school, whole community, whole child model developed by the Center of Disease Control. This effort involves many internal partners such as Eat Right Philly, Student Health Services, Food Services, Athletics, Health and Physical Education, Green Futures, and external partners like Get Healthy Philly. Increasing school breakfast participation is one of the important strategies in improving nutrition and physical activity environments, reducing obesity rates, and increasing student readiness to learn. We recognize that we have room for growth and have been working with schools and stakeholders over the past few years to unlock the doors to increasing access to breakfast for our students. According to the School Breakfast Scorecard, released in the beginning of this year by the Food Research and Action Center, FRAC, the district ranks the 41st among large school districts nationally, an improvement over our placement of 45th last year, with more room for improvement. Our current breakfast goal is to increase the average daily breakfast participation rate from 43% to 50% of students in attendance by June of 2019. To reach this goal, we need to serve an additional 5,500 breakfast meals to our students across the district each day. We can achieve this goal, but we need support. Breakfast in the classroom is the best way to increase breakfast participation rates. The Office of Research and Evaluation's analysis of the district's breakfast participation rates confirms that schools have adopted school-wide breakfast in the classroom, that schools that have adopted school-wide breakfast in the classroom have an average participation rate of 70%, whereas schools with cafeteria-only breakfast have a 29.5% participation rate. We are requesting council support in supporting efforts and work with administrators, teachers, and families to expand breakfast in the classroom offers in their schools. The district is committed to working with stakeholders in schools to keep the momentum moving to ensure all students have access to healthy breakfast. Included in the testimony is a chart, a graph that shows the average daily breakfast participation by councilmatic district. Okay, I understand we also were requested to provide more data in the individual schools, which we're gathering now. So what have we achieved? All schools are being encouraged to add an alternative breakfast model. This will provide more students access to breakfast. We have expanded access to 89% of our schools offering breakfast after the bell for school year 18-19 thus far. We are meeting with interdisciplinary teams to discuss the best breakfast models for each school. We are currently implementing the Food and Research Action Center grant awards that will provide additional resources and funds for 20 school district Philadelphia schools to improve breakfast programs. We have targeted 30 schools for school year 17-18 and 31 schools for this current school year 18-19, to have an alternative breakfast service model in place. We are monitoring maintenance schools where we historically serve more than 70% of students in attendance breakfast to continue to do so. We are working with community partners like FRAC, American Dairy Association Northeast, Eat Right Philly, to improve breakfast access. We seek feedback from students on new breakfast items during the annual food show and annual student survey. Annually, we offer contests and promotion to encourage participation. Looking ahead, food service will continue to expand breakfast access and offer alternative models to provide breakfast to these students that need it. Food service will continue to expand the groups of targeted schools while moving some of the current targeted schools to the maintenance list. The Office of Research and Evaluation is conducting analysis of School District Philadelphia data to look at breakfast initiatives, participation rates, and attendance. They're also conducting a qualitative study of breakfast implementation, which will look at successes and challenges with regards to different models of breakfast delivery. The Office of Research and Evaluation is looking into bringing together various data sets on health, nutrition, and academic outcomes in order to better target schools for specific interventions, for example, fitness levels, BMI, food insecurity, school climate, attendance, nurse visits, and asthma. And Eat Right Philly across the district is supporting breakfast promotions in schools by providing education, promotional events, awareness, messaging, and providing technical assistance to schools to connect with food service and alternative breakfast service models. Thank you for the opportunity to be here today and discuss this critical issue.
Thank you so much. Next witness, please.
Good afternoon, Chairperson Gim and the Committee on Children and Youth. I am Terry Krawowicz, the Program Director for Philadelphia Parks and Recreation. I'm here to testify on Resolution Number 180828, which was co-sponsored by Councilperson Reynolds Brown. Knowing that food insecurity is a real issue for children, Philadelphia Parks and Recreation is continually looking for ways to efficiently and effectively improve the overall food program and increase the opportunity for children to receive a healthy meal. At present, Philadelphia Parks and Recreation operates one of the largest summer lunch and after-school supper programs in the United States of America. At the height of the summer lunch program, there are over 600 delivery locations throughout the city where meals are distributed. The department provides 2 million meals to Philadelphia youth 18 years and younger throughout the year. During the summer food service program, which is an extension of the school lunch program, over 20,000 youth per day receive a meal. During the school year, over 100 sites receive meals, serving over 2,000 youth per day. In the summer, meals are provided at playgrounds, recreation centers, and community day camps where children can partake in structured programs and receive a healthy breakfast, lunch, or snack. Additionally, Philadelphia Parks and Recreation serves over 400 play streets, which allow youth who do not live close to a PPR facility to have a safe place to play and receive lunch and a snack during summer break. In an agreement with City Council, pursuant to legislation sponsored by Councilperson Blackwell, Parks and Recreation also provides meals on select designated days when schools are closed, but the city is still open, to afford youth the opportunity to receive a healthy meal. This feeding program for children is citywide and takes place in recreation centers. Thank you for allowing me to testify on this very important matter, and I'll be happy to respond to any questions.
Thank you very much. Councilmember Reynolds Brown?
Thank you, Chair Lady Kim. So where are the gaps? Because you're all doing good work. It's clear that there, well, maybe not be, there appears to be silos. Do you all meet around this issue? When I say you all, Department of Public Health, Department of Parks and Rec, School District. Is there a glue group that sits down periodically to tackle this issue?
You want to take that?
So I think I mentioned the Mayor's Food Policy Advisory Council. That is one space. I think there are lots of different spaces where conversations have been happening specific to certain programs, and you all can correct me if I'm wrong. I mentioned the Summer Meals Coalition is a space where we're all meeting to talk specifically about summer meals. There's the WIC Coalition.
Okay, you're going to have to slow up because, you know, the brain doesn't capture all that kind of content information as quickly as we hear it.
Sorry.
So speak to the summer, what was it?
So there's the Summer Meals Coalition.
Okay, so let's stick with that.
Okay.
Because that's a big piece, and I've heard each sector speak about it.
Yep.
Is there glue where folks sit down to sort of shape out what the strategies are going to be for summer 2019? Is that happening?
Yes.
And how often do you all meet?
Oh gosh, well, since January we've met twice, and we have another meeting coming up in the end of this month or the beginning of next month.
Who's responsible for pulling those agencies together?
We've been working with Get Healthy Philly.
Get Healthy Philly?
Yes.
And so that's the nonprofit?
That's the other name for the Division of Chronic Disease Prevention in the Health Department.
In the Health
Department.
So is
division,
it fair to say that the Health
the Mayor's
Department?
Office of Education.
All right, so I've heard four different, where do all roads lead to? Do they lead to the Mayor's Department of Office of Education? Do they lead to Department of Health? Because we're here because there are gaps. We have all this great resource, and we're not getting to those who are most, what this equation is all about. So the purpose of today is to get our arms around tangible, actionable strategies so that we're not having this conversation next year.
Right. So the Summer Meals Coalition is co-convened by Parks and Recreation, the Mayor's Office of Education.
Okay.
The Health Department is a part of that. All of the large summer meal sponsors, so the people that provide different summer meals participate. And there's been an analysis of where were their summer meal sites last summer.
Okay.
Where are the gaps in relation to children in poverty? How can we have a coordinated way that we are getting the word out to people about how to become a summer meal site?
Yes.
And then
so let's
after
stop
that,
right there. How does that happen?
So there's
And when does it happen? Because you can't do that in June.
Right.
You can't
So
do
it's
it
happening as we speak. There is a draft of an actual shared communication material that's putting in one place. This is where you can go to get information about being a summer meals site, and then it'll direct people to Parks and Recreation or to the Archdiocese or to other sponsors, depending on if it's a fit for them. And that's going to be rolling out in, I think, at the end of this month. And we are helping with getting social media, ad placement. There's also going to be radio ads.
Who's responsible for that?
It's a collaboration. So we are funding it. As the health department, we're funding some social media ads. Other departments are putting in funds for newspaper or print ads. There's people thinking about their networks and how do you actually go out in person and get this word out. So there's different people playing different roles in that.
All right. So school district, talk to us more about, soon school will be out. What, the only word I can continue to use redundantly are strategies. Is the school district looking at before, we lose these children to summer activities and to the rec department and other kinds of things during the summer?
Well, one of the things, we are part of that collaborative group that meet on a monthly basis, or now as we're getting closer, we'll be meeting more often. We're also communicating the sites that we have open for the summer, because we start to lock that down. And the estimated number of students who will be attending those summer enrichment programs, because it's not just those students that need additional credit, it's also community-based organizations that we're partnered with at schools. So it'll be about approximately 110 sites where we serve breakfast and lunch.
That are community-based organizations?
Pardon?
That are community-based organizations?
They're a combination of credit schools, extended school year for special needs students, but also for community-based organizations that have funding to sponsor a program at the school level. Okay, so there's about 110 of them historically, and that'll probably be about the same for this summer. Okay, then as we're getting close, the school district also sponsors a robocall to all students to start to communicate that message out.
Is that right?
Yeah, to let them know, okay, so if you're coming to a school district site with the breakfast, if you're enrolled in an enrichment program over the summer, we will provide that meal service, but also to start to communicate where they can get more information about summer meal programs throughout the city.
Are churches included in that mix of all denominations?
Churches, I can't answer that question.
So that would be a non-traditional space to look where children and parents go. And what I'm convinced of, having spent 5 years in higher ed, if we only went to high schools, we would have never met our numbers when I was at Penn State. We had to go to non-traditional places to recruit students. And so the question is non-traditional, like dancing schools and summer camps, and separate from the Department of Parks and Rec. I see that as one strategy, non-traditional space to look to make sure that the word gets out about the summer feeding programs.
It is my understanding that the Archdiocese is also involved in that.
Okay.
But as far as that non-traditional, church, I can't answer that question.
Okay. So as we go down this road, we want to list opportunities, if you will. Anything else you might want to add, Parks and Rec? So what are you all going to do differently this year than you did last year?
So
have you had a chance to figure that out yet?
Years ago, we had much higher numbers with our play streets. Those numbers have decreased because they are dependent on the community people serving as the play street supervisor. So we're going to go back to doing a more public advertising push for that to try and recruit more sites. We also have our folks who will once again go to the block captain rally and try and recruit some people there who may be interested in becoming a play street and being able to distribute the summer meals there. We're also working with the Mayor's Office of Education on the Summer of Wonder, which is providing some additional activities at the play streets. So even if we don't increase the number of play streets, hopefully it'll draw more kids to the play streets.
Yes.
So we'll have more kids who will be able to get meals that way as well.
Is there a communication that goes home with students from the school district, alerting and informing parents and families that that summer meals is are available in various places throughout those neighborhoods?
I don't believe we actually send them home with something, but it's the robocall that communicates to the families.
Okay.
We can look into that. We certainly can
Okay,
look into
so having been a former social worker and knowing that there's 7 different learning styles, you have to meet people at different places. Robocalls might work for some family, ain't gonna work for folks who rely on something coming home tangible in the mail, because you may not reach those families. So one recommendation I would offer up for consideration is layer the outreach. Do not rely on one medium, if you will. I think council has a role in that. We could do PSAs on channel 64. And so we should be seeing them ad nauseum, you know, April and May as we get ready for June, if we are serious about tackling this issue, so that we don't have this kind of conversation a year from now. So that's just off the top of my head. I want to invite myself to those meetings. So if you can make sure that my office, just to listen and participate. You can't stand on the sidelines if you want to change something. You have to get in the mix, right, Councilwoman Kim? Right. Yes. So I and a member of my team would like to be a part of those conversations, at least in the short run, so that this horrible statistic we're hearing we can get rid of. The families that are, you know, just hungry for something as simple as food. It's heart-wrenching. So thank you for the work that you do. We know that it's never done, but that's why we actually do this work, right? Because we know it's never done. Thank you very much for your testimony.
Thank you.
Thank you.
Thank you very much, Councilmember Reynolds Brown. Yes, so I had a few questions. Does Department of Parks and Rec and School District track hunger? We know that you have programs, you know, you can track participation. Do you actually track or survey your participants about questions about are they food insecure? How often are they food insecure? How often do they go hungry? What are the strategies that they currently have to address the hunger needs or a crisis in the family?
I know with Parks and Rec, we do not.
Okay.
I mean, that may be something we can look into implementing, but currently we do not.
Mm-hmm.
We do annual surveys. That is not one of the questions we ask, but we certainly can consider that.
I think one of the questions that we've got going on, so we typically rely on census data or, you know, self-reporting data about hunger needs. But I think one of my questions in order to do this is to go a little bit deeper into individuals who actually participate in our programs about whether we can understand hunger in a much more targeted way. And because we're dealing particularly with children who don't often get reported on about hunger, they can't self-report, for example, along census data lines, it would really be, I think, helpful, particularly for if Parks and Rec and if the school district recognizing that you absolutely must track, you know, program participation and all of those things. But part of the topic that we're looking at is the specific issue of hunger and unpacking what are the significant barriers that individuals have. It's obviously a very difficult thing, but if it's a relatively anonymous survey, we might be able to get more granular information than what we tend to rely on with, you know, large-scale aggregate data from a, you know, census survey or something along those lines. But it is one of the central questions that we've got going on that we don't actually understand what, especially that question of like, if you experience a hunger crisis, what are your top 3 you know, solutions, or who do you go to? Or if you didn't have, you know, if you didn't have an alternative, what then occurs? Like, do you go hungry? Do you not eat? How long has been the longest occurrence? But I think it would help us to do a lot, and it might actually fill out a lot of our programming understandings and needs as well.
Can I just clarify one thing? The annual survey that we do, it's for students. It's not for parents. So that would, in terms of hunger, we do ask how often do you have breakfast or lunch and those kind of things. But we do not. It would be difficult for us to ask a question like that to a student. But we'll speak to our Office of Research and Evaluation to see how we can gather that data. Now, we present at your office with data over time. So we do a lot of participation data tracking. We have a lot of information about what's going on in schools and parts of the city, et cetera. We're glad to provide whatever information that would be helpful for the council, help us, support us.
And I think, Coalition Against Hunger is going to be testifying. They do a lot of data collection and research, so I'm sure, there's a way for us to figure out what's appropriate and most helpful.
Yep.
Around this. And then, Mr. Grisella, I had a couple of questions because, this Breakfast in the Classroom program has been a big passion, and it was great to partner up with the school district in the last couple of years. And it is quite striking to see the difference between principals who participate in the school breakfast program versus those who do not. So almost 3 times you can improve participation in the program by almost 3 times, which is significant. But I know you asked for support. Could you clarify a little bit? Because my understanding has been that the primary complaint about doing breakfast in the classroom at the school district level has been that principals feel short-staffed, or there isn't kind of an understanding about how the first period teacher could adjust this into the schedule and make it not seem like you're taking away from my learning time. How can it become better? We did an event at Key Elementary School, for example, together when we did the launch of it, that showed a wonderful principal, Principal Chung, who really made it into a whole school initiative, also kind of did it as an incentive so the younger kids ate in the cafeteria. The older kids got to eat breakfast in the classroom, which was an immediate boost to their ego. It was much cooler. And also the teachers understood it as a way to have an opening to school time. So this is a way for us, there's a question on the board, discuss it in your groups while you eat breakfast, and then so on. So the barriers that we see are that principals don't generally understand how to manage the program, and then the second biggest complaint that we've heard is the lack of school support staff to do cleanup. So have you heard some of these things, or has there been some discussion internally about how to address it?
Yes, I believe, the number moves. I believe we have about 140 locations that have breakfast in the classroom at some level, and I can get that actual number for you. Actually, there are I think 94% of our schools have an alternative to cafeteria, in addition to cafeteria service. So breakfast in the classroom, breakfast carts in the hallway, and again, I mentioned in the data, it was 89% of the schools have after the bell breakfast service, which is incredible. Now, just for the record, Pennsylvania Department of Education allows breakfast in the classroom as part of the instructional day, so that barrier is off the table. If there are 140 schools that are doing it at some level, it's obviously doable. Now, in addition to that, over the past couple of years, we have not only provided whatever equipment they need, but we're also providing additional staff at the school level. Okay, so if a principal says, "Hey, we'll do breakfast in the classroom," okay, I'll assign additional staff to that school to help take the meals up to the school, to the classrooms, to help collect trash, bring it down and we have done that probably in 40, 50 buildings just this year alone, whether it's just adding additional hours or adding it to the current staff or adding additional bodies to help support that effort. So it is doable, and we'll do whatever principal asked us to do to try to make this work, and it can be done. And most of the successful programs, they engage the students in that process, like Key School, and Principal Chung has a great program there where students come down, they pick up, the meals are ready, they take them upstairs, they provide the meals to the teachers, they're served, whatever's left over, the children bring it back downstairs, we go collect the trash, whatever it may be. And in addition to that, we're also providing plastic bins in the classroom, okay, to avoid some infestation issues. And what that means is that if a child takes a meal, we can't bring that back down and reuse that meal. That's federal regulation. So if it's a non-perishable item like a piece of fruit or maybe like a packaged item like a muffin or something like that, they can put it in a plastic bin and they can offer it to the children as a reward or a snack later on in the day if they need that. So we're doing that in classrooms where teachers are working with us on that. So it can be done, and we see it across the board. We have some phenomenal, I don't know the actual number of school-wide breakfasts, but it's pretty significant, so it can be done.
Thank you, and I'd love to follow up with you a little bit on that. This has been the full-service cafeterias have been a passion of yours. I know, we've worked on this issue for over a decade, but what percentage of our public schools have full-service cafeterias?
Okay, so...
And that, I assume, means that they can cook on premises.
Okay, so we have 254 cafeteria locations, but that also includes charter schools, some private schools, some other cafeteria locations, okay? So we have, come September, we will have 123 full-service cafeterias. And we will
those
have...
district-managed schools? Those are within district-managed schools, or does that include
district-managed schools.
Charters? Okay.
Full-service cafeterias, and we will have approximately 131 pre-plate programs. Now, some of them are annexes, leased properties, et cetera, so they're smaller, but approximately, I know it's greater than 60%. I believe it's somewhere around 65% of the students now have access to full-service operations. The problem we're running into right now is that of the 130 locations remaining, approximately, we have identified within food service level that about 30 more can be converted to full service operations because we feel that they have the space and they have some of the characteristics required to convert them. But now what's happening, we're getting to a place where we have to penetrate walls, we have to expand into faculty lounges and adjacent space, and it's becoming more of a costly construction, which is outside the scope of food services. But we're going to continue to move forward with that effort. Over the last 5 years, I think we converted 60 schools to full-service cafeterias, so we're pretty proud of that initiative. The other remaining 90 or so locations, they will not be able to be converted without a addition or some type of a major renovation project at the school level.
So a couple of quick questions. When we're doing a new school building up in West Philadelphia, I can't remember, is it Berry School or one of the schools that we visited, and then there's the new Austin Meehan School. Will those have full-service cafeterias? Like, will all new school buildings have full-service cafeterias?
Absolutely.
Okay.
All new construction is full-service, state-of-the-art cafeterias and kitchens, yes.
And so one of the concerns that was heard is that, this question of like access to fruit and vegetables, we've had this discussion before. Are the full-service cafeterias in a better position to serve wider variety of options for young people, particularly not only at lunch, but also at breakfast? Like, have you tracked about whether their food offerings include concentration of fruit and vegetables that are not like applesauce and stuff like that?
Well, I'm sorry, the question is full service?
Will full-service cafeterias offer greater access to fruits and vegetables than like the pre-plate meals?
No, I don't think so. When we obviously in a full-service cafeteria, there's a broader menu, and for breakfast and for lunch, because you can prepare a broader range of menu items than you can in a pre-plate, and pre-plate cafeterias are very limited in refrigeration and others, et cetera. But when we bid out RFP the pre-plate contract 2 years ago. We're in the second year of a 3-year contract. There was significant enhancements put into that RFP, and we have several external partners that have been, and students and principals and staff that were involved in dissecting the specifications to come up with a more enhanced meal offering to the pre-plate programs, which included more fresh fruits and vegetables, salads, side salads, more out-of-season fruits and vegetables, whole muscle proteins. So significant enhancements went into the pre-plate contract, and it was quite an investment back into the cost of providing the meal. But as best we could tell from our customer taste testings and feedback from students, that these enhancements have really been recognized by the customer itself, and so we're pretty proud of where we are right now with our pre-plate program.
Yeah, no, I appreciate that, and I think that was one of the main reasons why people fought so hard to see, like experimental efforts to really diversify the meal offerings, particularly for pre-plate, because I mean, there's just going to be a certain number of schools that aren't going to have the full service options. But what we want to make sure is that both the full service options and the pre-plate are offering a wider variety, because we have a nutritional problem in addition to a hunger problem. And I'm just wondering how that's being tracked within the school district, And, you know, obviously you talk about customer surveys, but, you know, kids will definitely tell you how they feel about their meals. And so, you know, to the extent that we're really like getting kids excited about meal time and not rushing it, and not having it feel like a frenetic kind of like scream fest in the cafeteria, but really just having it de-escalating about, you know, quiet time and everything like that. Whether there are both improvements around the meal offerings as well as like, you know, a little bit more care about not, you know, some of our schools are really big, obviously, but that we're trying not to rush it so much. And so, you know, I'll be happy to continue this conversation a little bit more, but it's still an incredible passion of mine and fascinating to see. Yeah, how it's been evolving over the years. So.
And your staff has always been great.
Yeah. So thank you. Thank you very much to our panel.
Last question for Rec. Can you please map for me by councilmatic district those locations where the summer food programs are, so that we can see how we can do some kind of comparison, look-see at councilmatic districts and what period. The information will reveal itself. But if you can you do that for us? How, by when? Is April 1 reasonable, doable, or no? Tell me what works for you.
Is this for Parks and Rec?
Yes.
Yes. Yep. We can do that by the beginning.
Doable?
Yes.
Okay. Thank you particularly as we get ready for the summer.
Yep.
Thank you.
Thank you very much. Thank you for testifying. Will the clerk please call the next panel?
Dr. Mariana Chilton, Kathy Fisher, Dr. Linda Kilby, and Hillary Steibel.
Thank you all so much. We're excited to have you testify. A couple of things just to think about. We have to be out of here 5 minutes before 3 o'clock because we have another press conference. We want to make sure, so we have your written testimony. I know the powerhouse of information that you all bring can help us guide particularly towards recommendations for us. So to the extent that you want to use your time to tailor it towards the recommendations, we have reviewed your testimony already in terms of background and the crisis, but I know that myself and the council member are really both desirous of and in need of some real strategies that direct the city to do better. So with that, Dr. Chilton, if you could just state your name for the record and you may proceed with your testimony.
Hi, good afternoon. My name is Mariana Chilton. I'm a professor at Drexel University, and I want to thank both of you for your courage and for holding this hearing. It's an honor, and I'm grateful to be here. Thank you. I wanted to acknowledge that this hearing is actually happening on the ancestral lands of the Lenni Lenape people, and I pay respects to their elders past and present. I've carried out research on child hunger for 18 years while at Drexel University. Since 2005, my research study, Children's Health Watch, has interviewed over 11,000 families about food insecurity, employment, public assistance, discrimination, and adverse childhood experiences, ACEs for short, which includes exposure to physical and emotional abuse and neglect, witnessing violence, or having an incarcerated parent. Our research has found that not only is income poverty associated with food insecurity, but also that food insecurity is associated with exposure to violence. So today I focus on income and on violence. We're talking about the problem of children being affected by food insecurity. I don't want us to get hung up on terminology, but you can look at my written testimony that gives you the descriptions of those. Most important thing to remember is that when kids go hungry, it's a sign that the parents need financial help and social support. My research has shown, as you cited, that child hunger for working families has tripled over the past 12 years. And that should really put the Philadelphia business community on notice, because that means low wages make kids go hungry. So to be clear, the causes of food insecurity are lack of adequate income and assets and exposure to violence. I recommend a single solution, and that is that City Council should create a citywide plan and strategy to end hunger in Philadelphia. There should be a high-level staff person to work on the plan, make it public, and keep the city accountable. This plan should be announced through a city ordinance that declares that access to healthy food is a basic human right. The right to food cannot be provisioned through a charity model. Rather, the city should ensure families have entitlements to meet their basic needs. In my written testimony, I identify multiple ways to ensure the right to food. These initiatives include supplementing wages, expanding the earned income tax credit, securing unconditional basic income for TANF-eligible families, supplementing SNAP and WIC dollars during the summer, and establishing savings accounts that build assets and a sense of future for the children of Philadelphia. Because exposure to violence is a root cause of hunger, the city should establish trauma-informed programming throughout city services that support families and integrate more ways of screening and treatment referral to address violence at WIC and county assistance offices. Reducing food insecurity is possible. Our program, the Building Wealth and Health Network, which works with caregivers of young children on TANF, focuses on improving economic security by fostering asset building through trauma-informed approaches. Our program reduced the odds of food insecurity by 70%. We were able to reduce hunger without providing food. We focused on building economic security and reducing exposure to violence. I encourage City Council to make a serious commitment to ensuring the right to food for all. Many of us are here at the ready to help you achieve this goal. Thank you very much.
Thank you so much. Hello. Hi. Yes, you may, if you could just state your name for the record and proceed with your testimony. And I also would like to recognize the presence of Councilmember Maria Quinones Sanchez.
Hi, good afternoon. Thank you for inviting me to speak about childhood hunger today in Philadelphia. I commend all of you on your work and thank you for including me here. My name is Hillary Stiebel and I am the programs manager at Philabundance. We work with a network of over 350 agencies to distribute nearly 26 million pounds of nutritious food throughout our region each year. However, a recent study just announced that the issue of hunger in Philadelphia has grown by 22%. Philadelphia is the nation's poorest large city. According to the latest Feeding America Map the Meal Gap study, 75,000 children in Philadelphia are food insecure. Hunger is an issue of resources and access. We believe food is a right, not a privilege. In 2012, we launched our kids programs to specifically meet the needs of children and since have distributed nearly 600,000 pounds of food through our innovative programming. Our lunchbox, modeled after the Federal Summer Meals Program, provides free and nutritious, ready-to-eat meals for kids under 18 without the paperwork and restrictions to consume on-site. The Backpack Program provides 5 pounds of easy-to-prepare meals and ready-to-eat produce. The opt-out model has been praised by our partners, making it an inclusive experience and an opportunity for leadership and nutrition education. To accomplish our work, Philabundance relies on volunteers, food and monetary donations, and grants. But we know this is not a sustainable solution to hunger. In our efforts to address these challenges and make food more accessible, Philabundance now partners with schools, libraries, and hospitals to meet people where they're already connecting for other resources. We recently launched a new model in partnership with CHOP and Giant Food Stores. Philabundance is pivoting in our work to not just end hunger today, but to end hunger for good. We want to partner with the city to think long-term about how we can do this, but we need your support. To achieve the goal of ending child hunger, and Philabundance has a number of recommendations included in my written testimony. Today, I'd like to highlight just 3 of those. First, we ask that the Council to coordinate citywide efforts to establish clear goals and metrics to address hunger and achieve outcomes. We ask City Council to work with the mayor and create a senior policy position solely focused on addressing hunger. Second, we need your support for innovative public-private partnerships. Like that of our partnership with CHOP and Giant, the city should do more financially to support solution-oriented, non-traditional creative concepts, connecting groups and creating pathways towards ending hunger. We need you to promote, advocate, and support our federal and state nutrition programs. Program cuts made in DC or Harrisburg mean less for Philadelphia residents, and underutilized programs mean residents are not accessing the food that can help support their families. As I sit here with numerous partners and advocates today, I wonder, what is the city's goal for ending childhood hunger, and how do you plan to get there? Right now, the nonprofit organizations, schools, healthcare providers, and housing networks are working together, collaborating, and bringing our best to the table, but the city needs to take the lead on this initiative. Today, I am urging you, our city leaders, to lead this fight against hunger. I want to thank you for considering my testimony today. Myself and my colleagues are available for any questions. Thank you.
Hello, my name is Kathy Fisher, and I'm the Policy Director at the Coalition Against Hunger. Thank you to Councilwoman Reynolds Brown for sponsoring the resolution that brought about this hearing, and thank you to members of council for taking our input about this incredibly important issue. I will get right to the point. If the city truly wants to lessen hunger for children, we all need to be working together. We ask City Council to work with the mayor to create a senior policy position solely focused on addressing food insecurity. This person would oversee the development of a city plan to decrease hunger, work across city departments and with other allies to set concrete, actionable goals, and be accountable to council for making progress on those goals. We are all aware of the bleak statistics, our city's high poverty rate, and even higher child poverty rate, and the persistent food insecurity that plagues far too many members of our communities. However, this morning I'd like to share an observation that is often missed in the statistics. While our city's child poverty rate is extraordinarily high, impacting 1 in 3 children, more than 1 in 3, our child food insecurity rate is noticeably lower. There's no reason for celebration about this, but it's at least an indication that there are interventions that help. One way that children are protected from hunger is simply through the efforts of the adults around them, the parents, grandparents, and others who go without to provide for their children. This difficult to quantify defense against hunger should not be minimized. The city certainly needs to continue its work to help families gain income. But what other supports exist to help protect children from food insecurity? The federal child nutrition programs that provide breakfasts, lunches, snacks, and even suppers at schools, child care centers, and other programs in neighborhoods across the city. There are 3 main points about these programs I would like to focus on today. First, we all know that resources matter. From individual family budgets to the city's massive budget, there are tremendous challenges to meeting needs. We certainly do not have the luxury of turning down funds that can help. Food for Child nutrition programs is 100% federally funded. A majority of Philadelphia children are eligible, yet we are not leveraging these programs to the full extent possible. While there are countless schools, child cares, and other nonprofit agency staff working to provide children adequate nutrition, there is no coordinated citywide effort to promote and maximize the use of these programs. Second, all too often, we find that something that is everyone's job ends up being no one's job. When programs exist in silos with no overarching vision to ensure cooperation and efficient coordination, both across city departments and sectors, the status quo remains. This is why a new approach under a senior level policy person is needed. Lastly, a clear plan can yield results and lessen child hunger. Child nutrition programs already serve thousands and thousands of Philadelphia children each day. Many successful programs, both here and in other cities, can share strategies and best practices information to guide improvements. While we will not be starting from square one, the city plan must take a critical look at children who are being left behind and confront the inequities that abound. We still have dozens of public schools reaching far too few students with breakfast, too many areas of the city where children do not have access to summer meals throughout the full summer, and too many families facing barriers such as limited English proficiency to access critical nutrition programs. We need a senior policy person who will lead an effort to ensure that all children receive the nutrition support they need to remain healthy and thrive. Thank you.
Thank you so much, Ms. Fisher. Thank you. Please state your name for the record and proceed with your testimony.
Hi, my name is Linda Kilby, and I'm the Executive Director of North Incorporated, the managers of the WIC program here in Philadelphia. I'd like to thank you, Councilperson Blondell Reynolds Brown and her peers for inviting us to come and discuss this very important topic. Over the past 5 years, we have seen our WIC caseloads decline. We have gone from approximately 65,000 participants in Philadelphia County to less than 54,000. We have gone from having 11 WIC offices down to having 9. This would be great news if the decline could be attributed to the reduction in food insecurity and nutrition risk factors, but that's not the case. In our program, we have seen that the numbers have gone down for several reasons, and I'd like to present just 3 of them to you today. One is citizenship status. So many of the people who are eligible for WIC benefits feel that they have to be citizens in order to receive WIC benefits. This is not true. But in addition to that, because of the changes in Washington over the past 2 years, they are afraid to come for benefits for fear that their citizenship can be challenged in the future or that they can be deported. The second reason is the lack of available resources to conduct citywide outreach. In the past, we have been very active in participating in outreach efforts with other social service programs, but because of a significant reduction in funding in the past year, $1.477 million, we can no longer do those things. The third is access to eligible families. During the past 12 months, we have been forced to close 2 WIC offices. One of them was at Kensington and Allegheny, and the second one was on Lehigh Avenue. The changes that we had to make because of this significant reduction in funding have caused real problems for our clients. As you know, we live in a city of neighborhoods, and many people do not leave their neighborhoods for services. So if we're not able to provide service in their neighborhood, that's a problem. One of the things that could be helpful in addressing this is a partnership with the City Department of Health so that we would be able to go on a rotating basis to each of the city health centers and provide services through our mobile WIC offices, because there is no space within the city health centers. As I stated, these are just a few of the indicators that we have identified that are causing our caseload to decrease. So we're talking about the problem. What could be the answer? As City Council, we at North believe that you have the tremendous ability to help because you have the ability to make change. If we were to identify, as has been stated by my 2 previous speakers, a senior person who would be responsible to focus on hunger initiative programs, a person who would be able to create a central point of contact for all of us here in the city who deal with hunger and nutrition issues. This person would be able to conduct citywide outreach initiatives and bring together all the pieces of the food puzzle so that as a city, we can approach the end of hunger in a more strategic manner. The person in this position could work with food and nutrition programs to address the issues and the barriers that we are facing in regards to providing hunger relief services. I want to thank you for inviting me, and I hope that this is just the beginning of what we can do to solve the problem.
Thank you so much, Dr. Kirby, and I should say that it's no surprise that this panel came with an organized and clear request because I would expect nothing less, but we are getting the message and it is very deeply appreciated. So Councilmember Reynolds Brown.
Yes, I'll be brief. So before I get to 2 questions, above my desk in my office I have this quote: whose job is it? There's a story about 4 people named everybody, somebody, anybody, and nobody. There was an important job to be done and everybody was sure somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have done. That's the context of what I'm hearing. And so with that, yes, Councilwoman Gilman is right. We hear the message loud and clear that there needs to be the glue to tie all these parts together. And so the Maternity Care Coalition, is there any relationship with the Maternity Care Coalition, who's in the business of capturing children early with regards to what their needs are? It's just a question. I'm just curious.
Actually, in the WIC program, we capture those same children, and many times we share information, but we get them at birth.
Maternity Care Coalition does participate in the WIC coalition that we are advocating at the state to try to get the funds back to support the WIC offices.
Okay, so that linkage already exists.
Yes.
the role of the health center, someone said it as I was writing it down, and the health department may have left, but do you know if there is information, a promotion of the summer food program at our city's health centers? I'm just asking, I don't know.
I don't know. I know we provide summer program lunches in the WIC offices.
Okay.
So,
and then lastly, I too was very excited about the CHOP Giant partnership, and I'm looking forward to a similar kind of enterprise happening. Councilwoman Quinones Sanchez, help me remember the hospital in your district, the Children's Hospital. St. Christopher's, yes, yes, yes. So off record, if someone could tell me who we speak to at CHOP and Giant, because that's huge in terms of what it's going to do in that section of the city. And Councilwoman Quinones Sanchez district will certainly benefit from a similar kind of partnership. Thank you very much for your testimony. We hear your instruction and know that we're going to follow it. Thank you very much.
Thank you very much, Councilmember Reynolds Brown. The chair recognizes Councilmember Quinones Sanchez.
Yeah, I do appreciate not only your testimony, but your real succinct recommendations, because that's always very helpful. I have a technical question around the process of WIC applications, and have they gotten more difficult, and what happens to the drop-off? You say you're losing enrollment numbers, so people, I'm assuming, how often do they have to update their files? Is there anything in the bureaucracy?
it has improved because they come once a year instead of once every 6 months. Yes, and they can apply online. And now that, I guess in the past 4 years, we have worked with the delivery hospitals so that when the child is born, the hospital staff email us or fax us the information so we have the ability to contact the families within those first 2 or 3 days of birth. That has been very helpful. The state WIC system is in flux right now. 2-3 weeks ago, they began the new PIN computer system, and the first 3 counties began using EBT cards, the electronic benefit cards. Philadelphia does not begin this process until November. So I think that the EBT cards will make it a lot better. It'll make it easier. My major concern right now is that so many of the people who are in greatest need are afraid to come for benefits. They are afraid that if they come, it will affect their citizenship or their chances for citizenship. We have worked with Nurse Family Partnership so that if they are seeing some of these families, they can come and become proxy for them so that they don't have to come every 2 to 3 months to get their benefits. But I don't know what the answer is when people are being told over the media, if you go, you're going to be deported.
Yeah, we're very much interested. I know Councilwoman Gimm and I will definitely follow up with our immigration advocates around messaging and some sort of a level of coordinating. I know as we roll out the municipal ID program, I'm thinking about, and we're going to be doing mobile sites, the opportunity to also do some sharing. One last technical question again, because the issue of coordinating among the various institutions. What's the data sharing between the school district and the WIC offices around children?
There is none.
Okay, very important piece.
We have asked the Department of Health at the state level to do data sharing with DHS around families that are receiving SNAP and have toddlers who are not enrolled in WIC. They are working on it, but it's not happening yet. And the other thing that the Department of Health could do is make it easier for WIC clients to have their income electronically verified through the system. That is not the WIC agency's fault that that's not happening, but that can happen with other programs. SNAP and Medicaid, there's electronic verification, and the Department of Health's computer system is behind on that piece.
Yeah, I think we have to, again, we know there's 175,000 children at the school district, and we all suffer during the summer, when we know the drop-off is going to happen. I just think we need to figure out a data sharing mechanism so that those families have a streamlined way of doing this, right? So even some school-based enrollment, when we're doing kindergarten registration, when we're doing, so that just elevates the need for this one person that could really help coordinate some of these systems pieces together. Thank you, ladies, all for your work.
Thank you very much. Thank you to this wonderful panel. Will the clerk please call the final panel?
Mahona Sadiq, Nick Frontino, Jacob Zaitchik, and Leanne Luong.
Hello and welcome. For many of you, we already have your testimony, so if you, again, could keep it short. Unfortunately, we have to end the hearing before a press conference shortly before 3. So I want to thank everybody for being here and giving us your time on this important issue. Why don't we start with Ms. Long? But welcome to City Council. If you could just state your name for the record, and you may proceed with your testimony.
Sure. Thank you. Good afternoon. My name is Leanne Long, and I want to thank you for having me today to talk about my project, Food for Thought. My project focuses on combating hunger in Pennsylvania through donations from supermarkets and restaurants. Not only is this an opportunity to reduce hunger, but also to help the environment and to eliminate waste, which you will see in my research. This project is an effort to benefit everyone. People who need food but are unable to pay will get it, and everybody will benefit from a healthier earth. I have been researching both successful and unsuccessful acts toward combating hunger. I have been in contact with a couple different people, such as the assistant manager of a Panera Bread franchise, Mr. Mike Schenk, who provided me with all of the details and best methods employed for food donation by a restaurant, as well as with the manager of the Ardmore Food Pantry, Karen Kaminskas, who not only gave me feedback on my project and food donating in general, but also gave me less logistical and factual information and more emotional. She works weekly with her community and is genuinely empathy-driven and has true proximity to the issue, helping me see from the heart rather than from statistics. At the Germination Project Gala, I had the honor of meeting Philadelphia Councilwoman Blondell Brown. Now, I am here today to better understand the problems with donating food and further emphasize the evident issue of hunger that must be tackled in an effective manner. I will continue to work locally, but I can only drive so far and convince so many people. Though with encouragement of or any legislative actions taken by the Philadelphia City Council, I am hoping so many more places of food production will be on board. Establishing more concrete regulations, accessibility, and protection for these places would also be incredibly crucial, because the fear of a lawsuit should be the last thing keeping food from a person who is hungry. Some additional thoughts I have about addressing hunger is following France's model in constructing a bill that requires certain areas of food production to donate excess food. As in France, the law says, quote, all supermarkets over 4,304 square feet in size must hold contracts with nonprofits or food banks, end quote, according to USA Today, and stores may be fined $4,500 for not following the law. Now, everybody in my community, whether at school, with my friends, or at home, everyone is fully aware that I am a food fanatic. Growing up with parents who were forced to escape their home country during a period of war, I have always been taught the value of food and to never waste any of it. I am extremely grateful that I have not been in the situation where I was starving for a long period of time. I have only experienced an ounce of that when I fasted for a family member that passed away. But my parents have explained to me the feeling of starvation and the fear of not knowing where your next meal may be. That emotion is something I wish no one would be forced to feel, a situation I wish no one would have to experience, let alone children. It is truly an injustice for safe and healthy food to be thrown out when there are food insecure people, and even if I am individually unable to construct a long list of participating restaurants and supermarkets, or my legislative recommendations are unable to be implemented, at least this will spark some food for thought. Thank you.
Yes, thank you so much. Please state your name for the record, and you may proceed with your testimony.
Sure. Good afternoon. My name is Nick Frontino, Managing Director of the Economy League of Greater Philadelphia. Chair Gim, Vice Chair Reynolds Brown, Councilmember Quinones Sanchez, thank you for the opportunity to testify today on child hunger in Philadelphia. I want to start with two high-level observations about food-related landscape in Philadelphia. There exists what we consider to be a deep rift. On one hand, Philadelphia has some real assets and expertise around food, whether that is the rising profile of our restaurants and bars, the deep community legacy and tradition around community gardening, or real corporate and industrial expertise around food processing, production, distribution. There's real strengths here that are related to food. But then at the same time, as we've been hearing today, there's some really stark and deeply ingrained food-related challenges around access to food, hunger, and the underlying factors around income, access to opportunity, and jobs. We at the Economy League have been around for 110 years. We're an independent research organization that has deep knowledge of the Philadelphia area, but we also have access to a broad network of private sector actors, nonprofit actors, and then work regularly with government agencies and organizations as well. And we are interested in finding ways that we can deploy those two assets of ours, our deep knowledge and our broad network, to harness what's best about our food economy to tackle some of the most challenging issues that we face around food. And I want to talk just briefly today about an initiative called the Full City Challenge that we have partnered with local news site Billy Penn on to try and do just that. So, and I will say that there is, as we have seen today, an impressive array of organizations and initiatives that are focused on addressing these issues. But with the top line indicators not moving in the right direction fast enough, it's clear that there's a real need for more. And I think the folks that we've heard from today will agree with that. And what we at the Economy League are interested in doing is providing a supportive environment to encourage people to innovate and experiment with new ways to deal with complex challenges like child hunger. So with the Full City Challenge, we partnered with local news site Billy Penn to issue a call to the community for ideas, taking what is best about, leveraging what's best about our food economy and our food scene here to tackle issues of food security, food insecurity, and hunger, and the underlying causes. We went into this somewhat blindly, not knowing what type of response or interest we would get. We got 32 submissions, including from over 100 people from across the city, and we had to do the hard work of whittling those down to 5 finalist teams that we put through what we call a rapid incubator workshop. We recruited on a volunteer basis almost 20 professionals from the business community, the entrepreneurship community, the food industry, and the nonprofit and foundation world to help these 5 finalist teams refine and kind of break down and reconstruct their ideas. They then pitched their ideas at a public event at Green Soul on North Broad. We had 6 food industry celebrity judges from Philadelphia, and we awarded a $5,000 prize to the team called Hospitality Together. I can talk a little bit about that later in questions if you have questions. To implement a small-scale pilot of their idea. At the same time, we also engaged the crowdfunding platform GoFundMe to help the company itself, to help our finalist teams raise money. Together, they raised over $28,000 in the span of a week. And over the span of just a few months, we mobilized about $36,000 and hundreds of people towards innovative ways and approaches to try and tackle some of the challenges that we've been talking about today. Going forward, we will be working with the winning team, Hospitality Together, to place and implement a pilot of their unique earn and learn training model that leverages partnerships with restaurants and bars and an online university curriculum based out of California to help 15 youth over the course of the next several months, enter into this program, get job experience in food, in restaurants and bars, while also studying and gaining access to education and mentorship. We're partnering with Billy Penn, the online news site that'll be providing ongoing coverage of this as a way to kind of raise awareness and visibility of what it takes to actually try and untangle these very complex knots and civic challenges that we're talking about. This is a new way that the Economy League is trying to put itself out there to deploy what we can bring to the table to address complex civic challenges. We picked food as the first example, or as the first kind of issue area that we're focusing on, because we know the challenges are great, but we also have some great assets around food, and we're interested in finding ways that we can build on our strengths as a community to tackle some of our biggest challenges. Thank you, and I'm happy to answer any questions.
Thank you so much. Yes. Hello.
Thank you so much for the opportunity to speak. My name is Jake Zajcik. I'm here today representing the American Heart Association and our terrific advocates. My work with the American Heart Association is taking me really all throughout this city to meet with families, specifically families with young children. Many cases in non-traditional spaces, churches, small nonprofits, community groups, retail spaces, you name it. We have gone out to these locations to speak with families in this city. As we spoke with Philadelphians all throughout this city, it was very apparent to us that Yes, there are gaps in the system, but in those gaps, we needed to really have a policy and an impact with families with young children. That is why, working with these community groups and community organizations, we at the American Heart Association would support a policy that would make the default beverage for kids' meals, either water, milk, or 100% fruit juice under 8 ounces for all restaurants in the city of Philadelphia. And the reason we believe in that is because 85% of families in the nation eat at restaurants more than 5 times per week. So we need to get these families and get these children where they already are in these non-traditional spaces and have a conversation about having a healthier options and making healthier choices. Today, I wanted to bring up a gentleman, Chef Dennis Ortiz, who I had a chance to meet at the 25th PAL District in the Salvation Army building right there, who does cooking demonstrations with children. I've worked with him and have seen the great work he has done with 5- and 6-year-olds and really the fun times that he has had. I'm an awful cook, so he always helps me and guides me myself, so I do thank him so much. Once again, I just want to, before I conclude and pass over the mic to Chef Dennis, really want to thank Councilwoman Reynolds Brown this afternoon for all the tremendous work that she has done and children's policy throughout her amazing career. We know that it's not over yet. We know you're going to continue, that great work, but wanted to give over, pass the mic. I know we only have a few minutes to Chef Dennis.
Chef, please.
Thank you, Jacob. And I would like to thank Council for giving me this opportunity. My name is Dennis Ortiz, and I've been working with American Heart Association for the last 3 years. And like Jacob mentioned, we've been everywhere. Lately, since last year, we've been also tackling schools, junior high schools, and also kids that are 5, 6, 7-year-olds as well. We also did a couple of summer programs with Concilio nonprofit organization, which Adonis Banegas helped me get that connected with. It was great. And what I've noticed is that kids do want to eat healthy. They are really open to these opportunities when you are faced with, living in a place where you don't have that many choices and everything that's advertised is either junk food, etc. Junk food comes along with a junky drink, basically. I believe in this bill that we should, implement because it's something that kids are open to. I think it's important that kids start a healthy lifestyle from the beginning. These are things that are going to stick with them because I've been on my own, personal mission to become a healthier version of myself. I also believe that a lot of the choices I made when I was young contributed to the hardships I face to this day and continue struggling sometimes. Today we're not asking for much. All we want is to implement a healthier drink option, which would be a great start to motivating our youth to a healthier lifestyle, a healthier Philly. I truly hope that a concrete policy indeed goes through and gets in place so that we can get started. Thank you very much for your time. I really appreciate it.
We really want to thank you, Chef, for your work, and thank you so much for your engagement.
You're welcome.
Yes. The testimony was amazing. Amazing. There's so much good stuff going on. We just have to figure out the glue. And to quote you, Sadiq?
My name is Nick Frontino. Mahona Sadiq is a
okay.
colleague. She's not
Your colleague then.
She's in the back.
You said, how do we untangle these complex challenges? That's really what's before us. All of the testimony was outstanding. I am curious to know, as a former student, Ms. Long, where are you a student?
Oh, I'm a student at the Agnes Irwin School.
Oh, wow. That's an amazing school. I'm biased.
Thank you.
My daughter went there. Thank you all so much. You've given us much instruction and homework. Thank you.
Thank you very much. Thank you very much to this panel. Is there anyone else who is here who would like to testify to this resolution? Seeing none, the public resolution on hearing on resolution number 180828 is recessed to the call of the chair. Thank you, everybody, for your attendance here. Thank you.